Supersonics Money Transfer is giving you an unbeatable bonanza from now until the end of October. Yes! From now till the end of October, you stand a chance of winning a bag of rice when you receive monies in the Gambia from UK, Europe, USA, Canada and Switzerland with Supersonics Money Transfer. Amazing! So from now till the end of October, every time you receive monies in the Gambia from UK, Europe, USA, Canada and Switzerland, you stand a chance of winning a bag of rice. Only 100 bags available, so hurry now and be part of the 100 lucky winners in this special unbeatable bonanza from now until the end of October with Supersonics Money Transfer. Enjoy our safe, fast, reliable and convenient money transfer service with the largest payout network in the Gambia with charges starting from $0. Yes! Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics. The unbeatable bonanza with Supersonics.
Tamala yoonu gàddaay bu ànd ak xaaxaan dégg xiif nammel ci réewam ak réccute déglul ma Keba Top mi bokkoon ci gaal mu suuf mi mu nettali ñu jaar-jaaram.
ko métti trop ci biir gaal because di nga toog seben sa soo ko bëggee problème la because of seddaay bi naka la mel lépp
daal de neexul yàlla waaye daal neexul ba neexul waaye daal dëgg-dëgg bokk na ci gaal gi ma ne ko mu ne ma ne ko gaal ban la mu ne bi ñu dee ma ne ko waaw ba tey alhamdulilah lu ci yàlla def rek mu naka la def mucc na wala de bu fekkee dafa mucc nga wax moo su fekkee ba tey dafa dee nga xam ne yàlla moo indi nit.
bu ma ko jos yigéey maa ngi doon jooy.
man bu ma ko déggee foogoon naa ne daal Keba du ma ko tegaat but.
moo ne yooyu kay dafa métti si man torop waaye man dama nekk nit koo xam ne man suma rongoñ yombut pour mu génn.
fekk maa ngi woon exam sax at UTG ak suma biir bi maa ngi doon study ñu call ma ne ma kii de ñu ne dafa gaañu mooy suma friend bi rakam kooku dafa gaañu ñu ne ma dafa dem si gaal ma tiit be mënuma jóg sax fu ma toog suma tànk yi dañ bañ because of my condition léegi si laa laajte ma ne kon Bakeba mu ngi si seen boot boobu noonu ñu ne waaw ma ne kon moom tamit dee na.
toog naa 3 days yoo xam ne lekkuma 3 days boo xam ne si biir gaal bi kenn lekkut kenn naanu kabi tamit mooy loolu problème la day nekk xëccoo bi amuñu woon lefin tamit baas ndox bi daf day ñëw di dugal noonu ba soo seddaay bi nga dee fanaan boobu bor set.
moo dem dara laa si yëgul affaire yi gaal bi dafa ñëw as a surprise to me.
dafa risque daal so yoon bi moom soo si jaaree comme koo xam sax doo ko dee éene pour mu dugal ko dugal si yoon yu mel nii because dafa pain.
bi gaal bi capsized time boobu laa yëg ne Keba dem na.
lu ma expérience si gaal bi musuma ko expérience coono boobu musuma ko expérience si life dafa métti trop time boobu ak gaal bi nu mu koppee suñ kaw time boobu ganax bi tam mu ngi laa ci la yëngal time boobu doo mun a xam comme lan moo dugal buum bi sama biir baal.
non fekk buum bi mu ngi nekk si baatam bi area yi mënut a génn mënut a dugg si laa ñu lonki buum bi boot ko dama moom si biti.
ndax kii di Keba Top àggoon na foofu ca Babylon.
pour ñu meeg gaal bi mu oyof moo tax ñu bëri seen jacket yi daalay dañ ko sànni because time boobu noonu laal nañ géeju Spain bi ba pare.
lijjanti ko ci épisode bii di Tamala si siirisu gàddaay yuñ leen di indil koleel sa bët ci télé bi déglul ma Keba Top mi bokkoon ci gaal mu suuf mi dinañ leen ko indil samedi 3 fan ci biir weeru octobre 2020 fàttalekul ne Babylon mu ngi fii si Jolof waaye nag ci Boko Gome Tamala yoonu gàddaay.
Talking on our behalf to the public that this is a relief organization that depend mostly on donors to be able to implement our activities. As you have rightly said, all our activities are voluntary, and this is why our people are called volunteers. And this money you're saying is small, but it will go a long way to support our activities, because if we're using our volunteers to do the safe and dignified burials, to do the pickup of suspected cases and other activities, they need some kind of support to be able to feed themselves or transport themselves back to their homes. And this kind of support is what we're going to use to make sure that those activities are successfully implemented. So thank you very much, Mr. Baji. Now I'll hand over the mic to the board chairperson, Mr. Chaque.
To help us at the time of our greatest distress. Because when you take care of our dead people, when you take care of our sick people, when you help us to understand what the whole process of COVID is all about, we cannot do anything but to be grateful for you. I want to thank you very much, Mr. Secretary, and I hope others in the NGO industry and others in other walks of life will also come to the support of Red Cross. They have not put their hands off to cry for help. But we got to recognize what they are doing in this country. I want to thank you. Thank you very much.
Thank you very much, Mr. Cham, for those encouraging words. And we assure everybody that the humanitarian work that we're doing would continue to be improved upon as far as humanitarian response in the country is concerned. So next we have the presentation of the check from Action Aid to the Gambia Red Cross by the head of the HR department, Amiju. Thank you very much, Action Aid. This is very much appreciated. I know the finance department are very happy to receive this check. So you see them raising their hands up. So thank you very much. So finally, I would give the mic to the Secretary General of the Gambia Red Cross Society to give a statement.
Thank you very much, Madam Chair, and good morning to everyone, and welcome to the Gambia Red Cross headquarters. First and foremost, I would like to welcome my two dear brothers here, Mr. Cham, the chair of the board of Action Aid International, a long-time friend and a well-known person in terms of humanitarian and development work in this country, with Action Aid, and of course even within his own community. He's a household name and someone who has contributed to not only in the humanitarian but also developing human beings. And that's the work that Action Aid has been known for several years, particularly in education, nutrition, and of course the girl child, supporting the girl child, women, and also economic development activities. And to Mr. Baji, the Executive Director of Action Aid International. Mr. Baji also someone well known and has contributed immensely in the development of Action Aid in the Gambia to where it is today in many fields of humanitarian development, including health, HIV/AIDS, and many other economic development of women, the girl child, education, etc. I'm not really surprised to see this gesture towards the Gambia Red Cross. I'm not surprised because of the two people that are flanking me on the left and the right. You are both humanitarian and development workers, but also very, very industrious Gambians who want to see the Gambia to move forward, thereby joining us to fight COVID. I think it's the only thing that they are known for, and that's what they would do. The amount that is given is significant, but more significant is your coming here and your presence. I think, as you said, we work with volunteers. When we started the response to COVID, we had 0 butut to start the response. And as the chair said, we said to ourselves, we'll be on the ball. And I think this is what I said to all the team members, to say we'll be on the ball, and when people come, they will find us doing what we are doing. And that's how they would support us. Today, I'm glad to say that from that time to date, overwhelmingly, we've been supported by volunteers across the country. It's just today because many of them and many of our team members are in the field, and there are a lot of trainings going on across the country, together, jointly being organized by the Minister of Health and the Gambia Red Cross on surveillance, on risk communication in different regions. That is why most of them are now engaged in those trainings across the country. This is important for us, given the context of COVID-19, the current context of COVID-19 in the Gambia. You've seen the numbers go down, but I think we need to understand that COVID is far from over. We have seen and we've heard what is happening in Europe and in America, the second waves of infection. And sometimes when you have the second wave of infection, it's more deadly than the first wave of infection. This should be a lesson for us as Gambians. This is the time Gambians should come together and double their efforts, redouble their efforts to ensure that the preventive measures are considered important, are implemented. We should not be complacent because the numbers are down. The numbers are down could be due to lack of people going for tests. It could be for different other factors. So therefore, we should not be fooled by the low numbers of positive cases and then we just relax the systems and what we're doing. For us in the Gambia Red Cross, we did launch a scaled up risk communication and community engagement across the country. And this is what we are going to push forward. Few days ago, we launched here an initiative jointly with the Minister of Health and the UNFPA, which is linked to surveillance. And that's why we are doing the trainings now across the country. Because it's only with surveillance that cases can be detected early and be isolated and treated. And that's the only way we can keep COVID out of this country. Your donation today will go a long way in supporting what we are doing. I cannot really thank the volunteers, the hundreds of volunteers, enough. As you said, Mr. Executive Secretary, these are the people when things were tough. People were hiding in their rooms or houses. They were coming out here. There was a day I was standing here, it was raining heavily, and I saw the volunteers on one of the pickups in their PPEs going for burial services. One can imagine those volunteers on a pickup under the rain going to do that for what? For humanity. So I really cannot thank them enough. I really cannot thank them enough. And this is what contributed to the reduction of the cases in this country. Because the safe burial, the fumigation that we do, the disinfection that we do in marketplaces, in public places, and also in institutions and private houses, is what contributed to reducing the number of cases in this country. One can imagine if the volunteers were not there across the country doing those fumigation exercises or managing the dead from COVID, what would have happened today? So I want you to join us in celebrating those volunteers and to thank them sincerely for their services. We really cannot thank them enough. We will continue to push, and at this time, what is important, our priority is on surveillance, on risk communication, on community engagement. Let us continue to work together to get COVID out of this country. ActionAid, as you said, is not a new partner. I think we've worked with ActionAid in the past, and we have enjoyed a lot of good partnership and in development and in health. And we look forward to strengthening that further. The Gambia is our country. Gambia is different from other countries. I've worked in different countries in the continent where you have hundreds of NGOs and INGOs. But in Gambia, we are very few, and the needs are huge. So therefore, what it calls for is partnerships like what we have with ActionAid, in order to deal with the humanitarian challenges, but also address some of the development gaps, because we know government can do it alone. We have a responsibility as Gambians to develop our own country, our own community, and our own people. And we can only do that by uniting and working together and complementing each other in our various competencies and capacities. I would like to sincerely thank you for the support, for the donation, but also for coming here. I think it's very, very important, and we recognize your efforts, and I'm sure the volunteers will appreciate this very much. I thank you very much.
Thank you very much, SG, for thanking ActionAid on our own behalf. And as the SG has said, the most senior people of ActionAid are the ones present here, and this shows how serious they've taken this event or activity of donating this amount of money to the Gambia Red Cross is to them. So we again join hands to thank you, and as we said in the beginning, we hope to strengthen a stronger partnership with ActionAid in the humanitarian field. To the media, we also thank you for always responding to our services and for making public what the Gambia Red Cross and all humanitarian organizations are doing in the fight against COVID. Thank you all. So in a few minutes, we will also have another handing over of materials donated by Gambia Healthcare Matters to the Edward Francis Small Teaching Hospital to the Gambia Red Cross. So we can just wait for a few minutes.
Because of the voluntarism that the Gambia Red Cross is going through, and most importantly, it's because of what they are doing in terms of the fight against the COVID pandemic. We have seen the Gambia Red Cross volunteers going out supporting people who are in need. For instance, we have seen them pick corpses in public places. We have seen them go to families to help families bury their dead who have been affected by COVID. So we have seen the significant contributions that they are making in terms of the fight against COVID. And because they are doing it voluntarily, we thought really we owe them an obligation to really make a contribution so that we can help them be able to attain their objectives on behalf of the whole country.
Okay. And after doing this donation, how much do you think it would enhance the service they deliver to people? How would this make their work easier?
Our feeling is that, as I said in the presentation, we are giving them this money with no strings attached. That is, there are no condition in terms of how they are going to use the money. But our feeling is that because they move a lot, they go around the country, they go within the urban areas here, they will need fuel, and they also will need support to the volunteers, because volunteers are doing it without pay, and they need to eat, they need to drink, and they have other needs, So we think that this will help in supporting the volunteers in terms of meeting their basic needs during the services, and also in terms of the mobility within this area to support people who are in need. And that's our thinking, and we have confidence and trust, the Gambia Red Cross, that they'll put this money into very good use indeed on behalf of the whole country.
Lastly, what is your final message? What message do you have for Gambians out there, especially those volunteering for the Red Cross?
My message is that the Gambia Red Cross is working on behalf of the whole country, and they have engaged people who we call volunteers. They are doing this job expecting nothing from the Red Cross. They are expecting no pay. My call is that every Gambian should come forward and be able to support the Gambia Red Cross. Whatever we give to the Gambia Red Cross is not meant for them alone. It's meant for the whole country, because they are going to invest it in terms of responding. Because COVID is a very destructive disease. We have seen what it has done to us. It has affected every aspect of our lives, political, economic, social, and everything. Now we cannot go close to each other. We cannot shake hands. And we cannot go for our normal naming ceremonies and burials. So it has affected us as people. So if Gambia Red Cross is really working towards ensuring that this is eradicated, I think it should be an obligation, it should be a commitment for everybody in this country to donate. So I'm calling on individuals to come and support. I'm calling on NGO, civil society organizations. I'm calling on the public sector to come forward and support the Gambia Red Cross in whatever way, and we should not consider any contribution small. Whatever you give really will be significant and will really support the Gambia Red Cross in terms of meeting their obligations.
Thank you, sir.
Yeah, thank you.
So Ibrahim Jallo, the representative of Gambia Healthcare Matters, an organization based in the UK. And then finally, we have Dr. Keba Marena, the head of the surgery at Edward Francis Small Teaching Hospital. So the purpose of this event is to donate or to present some PPEs, some personal protective equipment, to the Edward Francis Small Teaching Hospital from the Gambia Healthcare Matters based in the UK through the Gambia Red Cross Society. These materials are donated to the Edward Francis Small Teaching Hospital in support to their preventive measures in responding to the COVID-19. The Gambia Healthcare Matters is an organization of Gambians based in the UK who have concern for health matters in the Gambia and are also doing their part to support organizations that are working in the health sector, especially at this period of responding to COVID-19, in extending the preventive measures. So part of their objectives is to support hospitals, clinics, and health facilities in providing adequate health care service to people living in the Gambia, both Gambians and non-Gambians alike. So we have Mr. Ibrahim Jallo, who would later give a brief introduction of their organization, and we would get to know more of what they're doing. This is a very uploaded initiative from Gambians that their Gambians abroad are seeing the efforts that we're doing nationally to improve the health system, and they're saying they would also do their part. Even though they are not within the country, they would see what contributions they have to give to the Gambia as a country to make sure that the healthcare system is being improved. Today we would do a presentation of 2,200 units of aprons, 6 units of non-touch infrared thermometers, 700 units of gloves, 2,250 units of surgical mask, 5 units of 5 liters each of hand wash, 100 units of face shield, and 300 units of PPE gowns. So firstly, I would give the mic to the Secretary General of the Gambia Red Cross Society to give a statement.
Thank you, Madam Chair. Thank you, Aissatou. Let me use this opportunity once again to welcome our guests. I'm not sure whether this is your first time to the Red Cross, Dr. Marina and Mr. Sane. I would like to say that what we are doing this morning is part of the role and the mandate of the Gambia Red Cross. The mandate of alleviating human suffering, but also based on the Gambia Red Cross Act, which is to complement the efforts of government, in particular the Minister of Health, both in terms of emergencies, but also in the development of the health sector. I would like to welcome, and this high table is very, very critical high table in the sense that, including myself, that if I understand, and correct me, Dr. Marina and Mr. Sane, that all of us were you just returned, and including Mr. Jallo, have been studied and worked abroad, decided to come and to serve country. And this is a very good example and something that all Gambians, wherever they may be found, should emulate. Country
Bluetooth
first.
Has been disconnected.
Country first, and country is important. Therefore, coming back home to give back, not only in terms of material, but your expertise, your experience, and of course, most importantly, your network. Because once you leave abroad, you either working or studying, you establish networks. Those networks are not for you as a person, but can be used, and you should leverage on those networks, both to build your career, but also to facilitate what you do in your life. And this is one of the reasons why we are here this morning, because a group of Gambians who felt that they owe it to their country, they owe it to their people, that they give back, but also they ensure that the country gets the best and the country develops. They use their network, they use their hard-earned resources, pull it together to give back to the people. So this is really something that is commendable. And I would like to commend the Gambia Healthcare Matters for what they have done. Created this organization since 2017, and I understand Dr. Marina was also part of the founders of the Gambia Healthcare Matters. And today he's on this side, and as well as Mr. Jallo, to ensure that there is continuity and the organization is sustained, and its principles and ideals are sustained, and its objectives are met. So this donation will go a long way in helping save lives, first and foremost protecting and saving lives of healthcare workers, enabling them to save lives and to deliver efficient and effective services. We at the Gambia Red Cross, we are very proud to be in partnership with Gambia Healthcare Matters, simply because our principles and our objectives are the same. So therefore, whatever we can do to facilitate their work in this country, we will do it. We'll go the extra mile. Before I end, one thing I would like to emphasize here, and I think the presence of these people here on the high table is really an important part of that. That is the issue of accountability. You have Dr. Marina, who is at this today, a founder, but also today at the receiving end, where the goods are going to be used. You have Mr. Jallo here, who's been there, and he's here now. And this is the way we work in the Red Cross. Anyone that has resources to put into our work, we ensure you are part of the process to ensure that it's delivered to where it is supposed to be delivered and used for its purpose, but also be accountable to those who have put it together, and also be accountable, and this is very important, be accountable to the beneficiaries, the people who will be needing the services. So I would like to say thank you and to commit that the Gambia Red Cross will continue.
Good morning, Madam Chairperson, our brother Alassane Senghor, the Secretary General of the Gambia Red Cross Society, my brother Mr. Sane, and former colleague at the Edward Francis Small Teaching Hospital, and also Dr. Marina, a staff at the Edward Francis Small Teaching Hospital, and also a founder member of the Gambia Healthcare Matters. Like Alassane just said, Mr. Senghor, it is very important for every citizen of every country to put your country first. And one of the things that the Gambia Healthcare Matters is doing is putting country first. And today's ceremony is an indication of that. That is the manifestation that the Gambia Healthcare Matters is doing. Founded in 2017, Gambians in the United Kingdom came together and thought of what is happening back home, the difficulties that some of us medical personnel are going through, and also our families as well. They thought it is very important to give back to our country. And this is how they came together. Mainly, most of them are medical personnel and other professionals from other walks of life. Came together and then formed this beautiful, productive organization and named it Gambia Healthcare Matters. Just to put it on record that this is not the first time the Gambia Healthcare Matters is donating to the Edward Francis Small Teaching Hospital. I think it is the third time we are doing this. And also refurbished part of the 8 and 3 ward where we donated some surgical materials to the Edward Francis Small Teaching Hospital. The Gambia Healthcare Matters is here to complement not only the efforts of the Gambia government, but also efforts of our colleagues in the medical field. And this is why we came together to support the Gambia government in this difficult time of the COVID-19 pandemic. Gambians all over, especially in the UK, particularly Gambia Healthcare members, are every day thinking and praying for Gambians in this difficult moment. And they don't only stop there, also by contributing towards taking preventive measures for our hard-working medical staffs. And also, I want to borrow this name from the chairman of the board chairman of the Action Aid, who said the Red Cross volunteers are combatants, and I do agree with him, and I applaud all of you for the great job that the Gambia Red Cross, particularly our volunteers, are doing. Here we are going to present today 2,200 aprons, 600 infrared thermometers.
At the Gambia Red Cross, being another volunteer organization, I think you can't overstate the importance of volunteerism. The Gambia Healthcare Matters is completely run by volunteers, people either donating their own funds or donating time, coming together to raise funds to do certain things. And I think that's in the ethos of what the Gambia Red Cross is also about. So I think it's very fitting that we have this here today. I would definitely like to thank Gambia Healthcare Matters for this donation. These are things that will definitely go a long way towards helping, in part, the fight against the coronavirus, and to continue to protect the healthcare workers in the setting of Edward Francis Small Teaching Hospital. Of course, we all feel maybe that numbers are decreasing, but we still have to continue to be vigilant, continue to take the precautions, and these are items that are definitely needed. They run out quickly because of frequent use, and definitely we're very happy and very pleased on behalf of Edward Francis Small Teaching Hospital. I would like to say a very big thank you to the Red Cross for facilitating, and for Gambia Healthcare Matters for continuing to think about us. As Mr. Jallo has said, it is not the first time that Gambia Healthcare Matters has donated to Edward Francis Small Teaching Hospital. They have done a lot of donations to the wards, usually looking at patients' welfare. It's not just about the healthcare professionals or delivering healthcare. One of the last donations was looking at blankets during the cold season, pillowcases, towels, things like that, to make sure that patients are at least also comfortable when they're in the wards, giving a TV, and gifts like that. I think they've also donated to Tanka. So it's about patient care as well, patient welfare, but also looking at healthcare delivery. So I think on my part, it's a thank you from Edward Francis for receiving, but thank you especially to my colleagues, I would say, in the UK and Gambia Healthcare Matters, who continue 3 years down the line. It hasn't died. The passion that they started with is still there. I'm still on the WhatsApp group, and it's almost daily. The messages are going through. Anytime something comes up, someone comes up with suggestions as to how we can help. And I just want to thank them for continuing that passion and not giving up on what it is that they're trying to achieve. And I would encourage them and others to continue with that spirit. Thank you very much.
So thank you very much, Dr. Marena. As he said, this would go a long way in ensuring the safety of healthcare workers who risk their lives to make sure that the patients get the required treatment from the health facility. So finally,
and we are appreciative of these donations, and we are grateful that people as far away as in the United Kingdom would be thinking of us and be donating through the Red Cross Society to Edward Francis Small Teaching Hospital. I do hope and pray that Gambians home and abroad would see Edward Francis Small Teaching Hospital as our center, not just where it is, Banjul. It is for every Gambian, and you'll be surprised to understand that during this COVID-19, some of the people who can afford to go abroad and have their treatments down there are forced to stay in this country, and where they go to is Edward Francis Small Teaching Hospital. So advancing that institution, making it fitting for the purpose, I think it's a great step forward. I thank you very much, and I thank the chair for having me here. As I say, on behalf of Edward Francis Small Teaching Hospital, thank you very much.
Thank you very much, Mr. Sane, for thanking the Gambia Healthcare Matters on behalf of the Edward Francis Small Teaching Hospital. And we hope with more efforts from them and from others, as you said, from other Gambians in other parts of the UK or other countries, would also emulate the same. And in the future, we hope that the Edward Francis Small Teaching Hospital would also be an international referral hospital, that people from other countries would look up to it and refer their parents due to its improved healthcare system. So on behalf of the Gambia Red Cross Society, we thank the Gambia Healthcare Matters, we thank the Edward Francis Small Teaching Hospital, we thank both the staff and volunteers of the Gambia Red Cross Society, and also the media for always responding to our calls, especially at this difficult time that we're living with this pandemic. Thank you very much.
gannaaw mbas mi lakkalee doomi aadama yi ci biir dëkk bi booda yi ñu daal di leen tëj est-ce que booda yi ñi nga xamante ne ñu ngi ci daan sukkandiku ñu ngi ci am jafe-jafe
am nañ coono de
liggéeykat yi est-ce que gars yi ñu ngi liggéey ñu ngi am comme nuñ daan amee
réew mi amul kenn ku denc dara
jigéen ñi nga xam ne ni ñu ngi doon dund ci booda bi di demalante ci ñaari dëkk yi di Sénégal ak Gambie rawatina Gambie at bu nekk luuma day am luuma fii nga xam ne ni moom mooy Farafeñe ak luuma Kër Paate est-ce que ren ji luuma yu amul sonal na jigéen ñi
te ñun ci luuma bi lañ daan jaayee di am liñ daan am
waaye jaaykat yi nga xam ne nii ñoom ñoo nekk ci booda bi di yëngatu ci wàllu jënd ak jaay gi jamono juñ toll nii lan leen fa nekkee
doo fi gis fii boo fi àndoon suba ba ngoon man nga am ñaari weer doo jaay benn Gambien
mbas mi nag dem na ba nga xam ne nii nit ñi fi mu toll nii sax gëmatuñ ko waaye li gën a raw loxo mooy ñi nekk ci booda bi lan moo leen nekk di sonal
xiif dépasse da lañ bëgg dépasse na mu ngi bëgg a të
Tamala yoonu gàddi déglul ma Keba Top mi bokkoon ci gaal mu suux mi dinañ leen ko indil samedi ñetti fan ci biir weeru octobre 2020 fàttalekul ne Babylon mu ngi fii ci Jolof waaye nag ci Boko Gome Tamala yoonu gàddaay
Supersonic's money transfer is giving you an unbeatable bonanza from now until the end of October. Yes! From now till the end of October, you stand a chance of winning a bag of rice when you receive monies in the Gambia from UK, Europe, USA, Canada and Switzerland with Supersonic's money transfer. Amazing! So from now till the end of October, every time you receive monies in the Gambia from UK, Europe, USA, Canada and Switzerland, you stand a chance of winning a bag of rice. Only 100 bags available, so hurry now and be part of the 100 lucky winners in this special unbeatable bonanza from now until the end of October with Supersonic's money transfer. Enjoy our safe, fast, reliable and convenient money transfer service with the largest payout network in the Gambia with charges starting from $0. Yes! Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics. The unbeatable bonanza with Supersonics.